Hello, my name's Dr. Ollie Hart and I'm one of the directors at Peak Health Coaching, and this presentation is to illustrate how we think we can build health coaching approaches into the current systems. It's our offer to integrated care systems and primary care networks, the future of the NHS. So why embed health coaching approaches at all? Well, we know health coaching improves outcomes and saves resources. As such, it's a core part of the NHS 10-year plan that's been well recognised. What we think is that as we transform things in the NHS, culture change is absolutely essential. And health coaching provides a bedrock for these personalised care approaches that the NHS 10-year plan aspires to embed. If you're not careful when you transform, you can divide and you can fragment. And we think that health coaching provides a common sense of purpose and language across a range of disciplines and providers: primary care, secondary care, community care, and the like. We know that health coaching approaches dramatically improve relationships between practitioners and their patients and clients, and between staff. And actually, to improve staff resilience and job satisfaction, this is absolutely essential at the moment. And we know that this approach can be very sustainable, particularly if you adopt a train-the-trainer style of doing things. So it's all very well having these great ideas, isn't it? We're all really good at that. We can sit around and come up with the things we ought to do. But actually putting them into practice is much harder. So implementing ideas, we know, is where the real hard labour goes in. And we put a lot of thought and time into how you can do this effectively and how it lands well in our current systems. So what we've learned is that it works really well to lay some groundwork in a system, warm it up with some webinars and some co-production workshops. You then move on to the core training. This matches the Personalised Care Institute's plan for 2 and 4 day training packages. So 2-day packages aimed at current healthcare professionals who need to learn health coaching skills and how to put them into practice in their system so it works well for them and the people they're working with. And then a 4-day health coaching training program for people where they'll spend more of their time dedicated to coaching approaches, having those half an hour to an hour long conversations with people. That might be your health coaches or your link workers. And what we've also learned as well is that for this to land really well in a system, it's useful to train a whole range of other people in some generic health coaching skills, what we call the what matters to you conversation. And aiming this at what the NHS calls band 2 to 4 workers, so receptionists, secretaries, healthcare assistants, can really help to embed this into your system. We mustn't forget as well the value of peer support, so training patients and training volunteer coaches can also be a highly effective strategy, and we've seen that work really well in some of the sites where we've worked. And of course, what's absolutely essential to maintain this is the ongoing system development and support that people need to maintain these approaches once they've had the initial core training. So building specialised coaching skills around particular areas like diabetes or complex social situations or chronic pain has worked really well, and we have some packages set up for this. We've also developed further coaching skill sets so people can deepen their skills and improve as they've had a chance to practice and gain experience and confidence. And really crucially is having a mentoring or peer support network so that people can support each other and collaborate and grow and bounce ideas off each other and build the confidence of the whole system together. So what does that look like at an ICS level then? Well, in our experience, running 2 to 3 webinars across a system is really helpful, perhaps an hour, 45 minutes at lunchtime, gathering together the key movers and shakers who need to understand what this is about and who are the people that can benefit most from the training and build their own local system. And we've often matched that with some co-production, either workshops or telephone calls, one-to-ones with particular people to make sure that the training is in sync with the culture and the ethos of the local system. And that's worked really well in some areas where there's particular ethnic needs or particular cultural things we should be sensitive to. Then thinking about the core setup training, well, the NHS has an aspiration to train 75,000 people in personalised care by 2024. They think that's the setup we need to embed this properly into the system, perhaps start this off properly and do it well. So how does that look for the 2-day courses? Well, probably around 1,500 people for each integrated care system, 50 or so per primary care network. And then the 4-day programs, we think it'll probably need to cover around 150 to 300 people having this more in-depth training which looks around about 7 to 10 people at each PCN level. And then the frontline training, well, we think thousands of people should benefit from this, and clearly that's not viable for an external company to train. So we would offer a train the trainer approach to that, so that you can scale it up and sustain that ongoing kind of knowledge generation into your system for a long period of time. And then that ongoing development, well, we think probably 2 to 3 cohorts in terms of specialised areas as people deepen their skills as health coaches or as healthcare professionals in particular areas. And then the further skill sets, deepening skills, complex reflective listening, challenging limiting assumptions, those sort of things we think may appeal to 2 or 3 cohorts a year. And crucially, these support networks, well, these should be for everybody. It's going to be an essential part of maintaining it in your system. So setting up peer-to-peer support, having really good systems for that to prevail is going to be essential for this to maintain in your system. So whilst we'd seek to work at an ICS level, have a systems approach, we think the implementation happens at a PCN level in these 30 to 50,000 neighbourhoods. And it's really important to understand the additional roles that each PCN wants to invest in. They'll already have link workers and a social prescribing system growing, but how many health coaches do they want to work with? How many care coordinators? And what's their need for health coaching approaches in their system with the people they want to employ? Alongside this, we've seen the real value of collaborating with the local voluntary sector. They can be a fantastic resource for building community level volunteers, and the health coaching approach built in at that level is a massive great enabler for a PCN. We've also seen the importance of talking to PCNs and practices about how to integrate health coaching into their current pathways. So every practice covers long-term condition reviews for around a third of their patients every year. So how can health coaching approaches add real value by perhaps reducing the time they need to spend with some people, improving the outcomes for others by using coaching approaches? We've also seen that strategies for searching for high benefit patients, the people that will really benefit from health coaching, can be really valuable. In some parts of the country, we know they've searched particularly for people with risks of metabolic problems, so people where their blood pressure is going off, their sugar scores are going up, or their weight is going up. And health coaching applied to people in those situations is seen to be really high value, having great results, reducing the demand for primary care appointments and improving patient outcomes. And of course, as ICSs mature and they develop their personalised care strategy, it's going to be really important that this health coaching approach meshes in with what they want to do. So hopefully that's been a little summary for you of how we think we can add real value to the way that ICS are developing their personalised care approach, and how the PCNs within the ICS can work really close with us to show some benefit for everybody.